In this third part of the gastrointestinal examination, I'm going to look for evidence of liver disease. This will involve looking for peripheral manifestations of liver disease, and as well as looking for an enlarged liver and the presence of ascites. I'm going to start by inspection. I'm standing at the end of the bed and I'm looking for a mass in the right upper quadrant in the area where the liver would be, and I can see that there's no mass there. I'm also looking to see if the flanks are bulging outward, as they may be if fluid or ascites collects in the flanks. There are many manifestations of liver disease which can be found peripherally. I'm going to start by looking at Todd's hands. I'm looking at his nails to see if the nails are unusually white, so-called leukonychia, which is a feature of low albumin state in patients with liver disease. I'm going to turn his hand over, and I'm looking for the presence of palmar erythema, a very red palm. You can see that Todd's palm is actually not as red as mine. It clearly does not have palmar erythema. Palmar erythema is located to the thenar and hypothenar eminence, and so I don't have palmar erythema either. I'm going to feel for a fibrous thickening across the palm called a Dupuytren's contracture. There is no evidence of that. And finally, in the hands, I'm going to look for evidence of muscle wasting, which can be seen if the synthetic functions of the liver are abnormal. I'm going to ask Todd to put his hands straight out in front and bend them back at the wrist. I'm looking for an abnormal loss of extensor tone, a so-called flap that you can see in people with hepatic encephalopathy. And I don't see any of that. Thank you, Todd. You can put your hands down. Up towards Todd's face, I'm looking for evidence of jaundice or scleral icterus. Todd, could you look downwards, please? And I'm just going to lift the eyelid to see if there's any yellow discoloration of the sclera, and you can see that there's not. Thank you, Todd. As I look around Todd's face, I'm looking for spider nevi. These are central arterioles with small blood vessels going from the central arteriole peripherally. Do not see spider nevi here. They're found in the shawl distribution and in the arms, usually in the drainage area of the superior vena cava. I'm looking for parotid gland enlargement. Enlarged parotid glands tend to lift the earlobes off the side of the face, and I do not see any evidence of that. In men, loss of secondary sexual characteristics such as loss of axillary hair can occur, and there's no evidence of loss of axillary hair. And also the development of breast tissue, gynecomastia, can occur in men. And I cannot feel the development of any breast tissue here. I can also look for peripheral edema, which could be a feature of a low albumin state, by applying some pressure over the blade of the tibia. And you can see that does not leave any dent, so there's no peripheral edema. Moving back to the abdomen itself, I can look for abnormal draining veins around the umbilicus, a so-called caput medusae. In patients with significant liver disease and portal hypertension, the spleen can also be enlarged, and so you can perform an examination for splenomegaly, looking for manifestations of liver disease. In terms of percussion, it's possible to percuss out the size of the liver in the midclavicular line, starting from above. Listening for when the note changes from resonant to dull. So the upper border of the liver is approximately this level. So I'll mark that in my mind, and then I'll percuss from below to catch the lower border of the liver. And it goes from resonant to dull. So the liver is approximately 7.5 centimeters in size, which is well within normal limits for percussion. There's a percussion technique to detect free fluid in the abdomen or ascites. This is percussing for shifting dullness. Normally, the fluid will fall by gravity to the lower part of the abdomen and reach a fluid level. The percussion note will change from resonant to dull when the fluid level is reached. So by percussing in the midline, moving laterally, it's possible to detect a fluid level. There is no fluid level here, and the note really only changes when it gets away from the air-filled bowl. If there was a level to detect, you would make a mark, either in your mind or with a pen, where the level changed, where the level was when the percussion note changed, and then ask the patient to roll towards you. Todd, could you come towards me, please? Okay. Now the fluid position will change by gravity. The fluid will percolate down and form a new fluid level, and it takes a few seconds for that to happen. And then this area, which was previously dull, will become resonant. And the area that was previously resonant will become dull, so the dullness will have shifted, hence the name shifting dullness. Thank you, Todd. We'll go back to In terms of palpation for the liver enlarges downwards directly. It does not cross the midline. Palpation can be with one hand or two hands, so-called bimanual palpation. Once again, starting in the right lower quadrant. You take a deep breath in and out. And again. And out. And again. And out. And once more. And out. Then I can detect the edge of Todd's liver just below the right costal margin, which is a normal palpation for the liver. Again, if you find an abnormally enlarged organ, it's important to listen for any friction rubs, and in the case of liver, also for vascular bruits over the liver. In this case, it's normal. If you do think you've found ascites by the percussion method, you can try and confirm that by generating a fluid wave. This is a difficult technique to perform with simply one person because it requires pressure in the middle of the abdomen. Sometimes you can ask the patient to do this for you. So I'm going to ask you to take your hand and just push down right in the middle if you can. Maybe just a little bit lower for me. If there's fluid here, you'll be able to generate a wave by tapping, and the wave will be transmitted through the fluid. The reason for the hand is there, thank you Todd, you can take your hand away, is that without the hand, the wave is transmitted through the subcutaneous tissue, and you can actually see that I can generate a wave without Todd's hand being there, and clearly that's not a wave related to fluid. In the presence of ascites, there's a high likelihood of finding ankle edema, and so if you think you found ascites, it's also important once again to check for ankle edema. And of course, in this case, there's none, because Todd doesn't have any ascites. And that concludes the examination for the liver and manifestations of liver disease. Thank you, Todd.
You're welcome.